Thank you so much. And thank you everyone for attending and making time out of your valuable day today to attend this session. My name is Didi Davis. I am with the Sequoia Project. We are the recognized coordinating entity here in the United States, and my title is Vice President of Informatics, Conformance, and Interoperability, meaning I wear lots of hats in the standards and interoperability world. And the most important, I've been doing this a little over 30 years. So luckily I have a lot of lessons learned the hard way in some ways, and hopefully I can bring some of my lessons learned to bear and share with you here. This is the standard disclaimer slide. Nothing that I am presenting here or should be construed as an official policy or position of the U.S. federal government, ONC, the Department of Health and Human Services. This is authored by me as a presentation, but ONC has reviewed these slides previously. We're going to cover several things. One of the most important is what is TEFCA, so the Trusted Exchange Framework and Common Agreement, a little bit about the FHIR roadmap, the implementation guide testing and pilots that we've done to date. The recognized coordinating entity has a FHIR-based directory for this implementation, so a bit about that, and then where you can find additional educational sources. So starting with, what is TEFCA? So for those who may not have been following the U.S. Events or maybe from another country and not aware of what we're doing policy-wise, in 2016, the U.S. federal government put together the 21st Century Cures Act. And the specific section is referenced here. The national coordinator will convene and develop a trusted exchange framework and common agreement. So that is TEFCA. Why is TEFCA really necessary? There's been a really large growth here in the United States of national networks, and many organizations have continued to join multiple of these networks. But with the COVID pandemic, we understood that we needed to really beef up access to public health and some of the other purposes of use for exchange that these networks may not be completely doing at this point in time. So today, all of the networks, just to be fully transparent, that exchange data in the United States, and there are 36 that are live today on a policy framework very similar to TEFCA, known as care quality. Those 36 networks are exchanging over 350 million CDA clinical documents every single month. So billions of documents are being exchanged every year, and it is only for treatment primarily, or 99% of it is for treatment. We need to expand that. So that's another reason why TEFCA has been pulled forward, and HHS and ONC are pulling that with our work to hopefully deploy this. The goals of TEFCA is really to establish a universal governance or policy framework to enable all of the exchange of data for all those different purposes of use with one data sharing agreement. I think I heard on a presentation earlier today that all of those different data sharing agreements are very difficult to obtain. So it needs to simplify the connectivity among organizations. And really, in my mind, one of the biggest goals is to enable the individuals, me as a patient, as a caregiver, or as an advocate, to gather health information in the journey of care, whether I'm the patient or if I'm helping with my mother-in-law or my father's care, or a friend or so forth. The benefits of TEFCA are very broad. So really the main is that trusted information across a nationwide source can be exchanged, and really from an individual perspective, all individuals can access their data. Providers and health systems can actually have the right information at the right time. Public health hopefully will be able to expand public health interoperability. Payers coming to table will be able to bring some of that administrative data, which is very informative as well, and help with some of the clinical care coordination. And you can read all the others. So I'm not going to read them to you. A lot of this is all available. You'll notice there are fact sheets for each of these different, what I would call stakeholders. The URL is at the bottom left of this slide. So what is the recognized coordinating entity? If you see kind of the umbrella graphic here, there are going to be what are called Qualified Health Information Networks, QHINs. So you get another acronym. Sorry to add another one to your overflowing library in health IT, but QHINs are applying to the recognized coordinating entity. There have been 7 that have applied, and they're in process of going through their testing to be designated. So these are candidate QHINs at this point, but there'll be multiple QHINs that'll underneath have what are called participants, meaning health systems, provider practices, public health agencies, payers, etc., and those sub-participants. So it may be a hospital system with a lot of physician groups and medical practices underneath it, for instance. So this is how the connectivity is going to happen. And hopefully all of the candidate QHINs will eventually become designated later this year and into next. And this will be an ongoing process. And hopefully the components that are used within TEFCA, the Trusted Exchange Framework, the one common agreement that they sign, standard operating policies and procedures. So there are a lot of SOPs, as we call them, that say what happens if there's been a breach? How do you identity proof an individual? All of these different components that are needed to ensure that trust is maintained. There's also the QHIN technical framework, which is really the specifications, the technical specs that is enabling this underpinning for the policy framework from a technical perspective, but they are testable. And then the QHIN onboarding process makes them work through that. All of those SOPs show what is that onboarding process and what are those metrics they're going to have to report and the overall governing process. Why is some of this important? There was this is a recent article that was just published by the Government Accountability Office. The report is linked in that report hyperlink at the top bullet. And the key findings are really that there are, TEFCA hopefully will address some of the persistent impediments to the electronic health information exchange and hopefully grow along those smaller rural hospitals where there's some of that connectivity not happening today. And the states also have helped propagate. Luckily, here in the United States, we now have over 90% of health systems that have electronic health records, but we now need to make sure that they're all using that plumbing to exchange for all purposes, including things like public health efforts, research in the future, and so forth. So now about, FHIR. This is the important part. The FHIR roadmap was published in January of 2022, so it's been over a year ago now, and that has not changed at this point. The U.S. is planning on rolling out TEFCA in various stages. The first stage, you'll notice, started in 2022 and goes all the way to stage 1.1, the common agreement. We are expecting and in process of updating that common agreement to allow for some of this FHIR exchange. The common agreement today in the QHIN technical framework really relies primarily on the IHE SOAP web services. The reason for that is what's being used in the networks today. The vendors, those 35 networks that make up those, the vendors that support those 35 or 36 networks actually are already exchanging with the IHE framework, but that doesn't mean that FHIR can't be part of the payload in that, and then eventually become a brokered FHIR API exchange. So this is something that we expect to evolve over time. Here in the US, to exchange for treatment and from provider to provider, they expect, all of these vendors are telling us they expect to continue using probably IHE SOAP web services for some time because it's very scalable, proven, and it's already implemented. But exchanging with patients, consumers, will actually be done with FHIR. So we're going to have a hybrid world, and that's why our roadmap kind of allows for that process. And we do expect to continue updating the common agreement. In 2024, we're probably going to have a version 2.0. And at that point, every one of these candidate QHINs and the designated QHINs will have 6 months to adopt the new QTF, the new QHIN technical framework. Now, the FHIR Facilitated Implementation Guide, there is an implementation guide. Brent actually just talked about UDAP. The US FHIR Facilitated Implementation Guide is based on UDAP, and it really facilitates dynamic registration. and interaction with the directory, the FHIR-based directory. So the hyperlink, the first one is actually the roadmap that I talked to you about just on the previous slide. The second link is actual draft implementation guide for the FHIR-specific components. And there has been testing completed to date this year in March of 2023 in Austin, Texas, and in May in New Orleans. And there were 9 organizations that participated, and we continue to improve and get lessons learned from those testing to improve the implementation guide so that it can actually be ready for prime time once the deployment is ready and moved into the common agreement and QTF. The directory services are based on FHIR R4. It is built on the HAPI open source reference implementation. The last release was April of 2023 that the recognized coordinating entity put out, but we are having a major update coming out soon as well. The implementation guide for the RCE directory can be found in the second bullet, and it includes things like an actual definition of what does mess support mean for the directory, and how does it tie to the common agreement and the QTF, and how that interaction needs to happen. And I've taken the liberty of, in the second bullet point, giving you really the main capabilities from the FHIR R4, the RESTful API, the FHIR read, and so forth that are necessary. There will be FHIR API keys accessible by the QHINs once they're designated, where they can update their directories for their participants and their sub-participants. And these are the educational resources that are available for all of this that I've talked about. I know that I've covered quite a few things here, but I wanted to make sure that we had enough time for question and answer. The educational resources you'll see in the link under the FAQs. And then ONC also maintains TEFCA resources on the healthit.gov website. We do have monthly educational sessions and informational calls that are open to anyone. So if you'd like to follow along our work, please feel free to, the last link on this slide takes you to our community engagement and those events, and you can register for those monthly informational calls that happen the third Tuesday of every month. The next one is next week on June the 20th from 12 to 1 p.m. Eastern Standard Time. And here's my contact information where you can follow up with me if you have questions. I'm happy to help in any way. And with that, I think I'm going to go ahead and open it up for any questions.
Thanks for your presentation. Are there any questions in the room?
Is there still a role for the regional health information networks for the RIOs?
Absolutely. Great question. In fact, one regional health information organization actually has applied and is in process. And then several of those organizations are part of a larger network that has applied to be, that has been designated as a candidate QHIN. That network actually has 62 regional and state health information exchanges. So once they're approved, those 62 can be brought under their QHIN as a participant or sub-participant, depending upon the stakeholders they bring to bear. So absolutely, there'll be a place. The goal is not to replace what they're doing. It's to give them another avenue to broaden their scope and hopefully fill in some of that white space across the U.S. that's not connected today. But absolutely, we hope that this will help support them, with their growth and expand their connectivity. Other questions?
Thanks, Didi. That was a great talk. What do you think? Do you think there's a decent, we're in Amsterdam. It's hi from Amsterdam.
Hello. Missing you. I wish I was there with you.
I bet. That's right. It's great. The weather's fabulous here. It really is.
I've heard. I've been hearing some of my colleagues that it's wonderful, that it's been a great event so far.
So do you think that the kind of TEFCA, QHIN, RCE, plus the technical infrastructure of UDAP, QBDE, some of this FHIR stuff that's happening in the US, is that just so specific to US government and society? Or do you think that there's technical artifacts or organizational artifacts that other nations, as they also work towards building out, easy on-ramps to national health IT interoperability should also be looking at? And if so, what pieces?
Great question. I'm hopeful that we're not just reinventing the wheel and doing something in the US only. So to answer that question, I'm very hopeful that what we do will be something that all other countries globally can leverage. I know I heard a talk earlier today about the nuts and bolts and learned something new about nuts, which I knew nothing about until that presentation. So I'm hoping that we can start comparing lessons learned. I do know there are some deviations to that, but I do believe that all of us can learn together. This is not something that's a one and done in one country. I'm hoping that this will continue evolving. The specifics that I'm thinking about that we can leverage is that scalability. As we continue to roll this out, I'm hoping that we can see how these specifications, implementation guides can be further constrained either at that jurisdictional level within that country, because there are state and jurisdictional laws, even here in the United States, that make it different across different states. So we in a way, kind of act like multiple countries just within the US. So I'm hoping that a lot of what we can learn can be brought to bear. I do know that we are, kind of throwing out what we have as the best case scenario. We are focusing more on UDAP here. And I know that there are pros and cons to it. That's why we're testing the implementability of UDAP and so forth in the dynamic registration, because certificates, I think it was brought up in the last session, the scalability of certificates when you're talking of hundreds and hundreds and thousands of different purposes of use. Even I've been talking to some of the vendors who are talking about using a different PKI certificate for every purpose of use. That's not going to be scalable. So we need to think about this from a pragmatic standpoint. I do believe one thing that we are doing that has helped others, we have US core. So I know that there's that foundational piece that a lot of folks are building. So I know there's a Canada core and there's different countries that are doing core based on their needs. So I'm hoping that that will be potential for leveraging, so there's a starting point, because some of that's been proven through certification with a lot of the vendors and the implementers today. So I'm hopeful that we'll continue providing that, but I'm also grateful for other countries letting us know, how is this working for you? Or is there things that we can share and educate you with based on these policy requirements? So I think the policy and the technical pieces, the technical is pretty well aware. A lot of the different countries are following that, but I think the policy pieces are the parts that we can share and hopefully, share our lessons learned with you as we roll this out a little bit more ubiquitously. Hopefully that answers the question.
Any more questions from the room?
We have a question online, if I can interject.
Yeah, sure.
An online question is that, are there any upcoming mandates for HIEs to implement this framework?
That's a really great question. And I thought about including a slide, but I was afraid it was going to get too much in the policy. Yes, CMS, the Centers for Medicare and Medicaid Services, has actually released a regulation that references TEFCA, meaning if you want to get the promoting interoperability, the additional funding as a provider, you will need to, by X date, be one of those participants or sub-participants on the QHIN under the TEFCA framework. So they are starting with CMS as the largest payer in the US to help incentivize and provide that carrot and stick, so to speak, to help get folks implementing that. There's also some notice for proposed rulemaking, what we call NPRMs, that are out already for public comment right now, that are also going to be considered and maybe passed as regulation in the future. So there's definitely work there. ONC, the Office of the National Coordinator, is helping coordinate that across CMS and other federal agencies. So we're hopeful that those regulations will only just incentivize it further. But yes, there are some already approved and deployed, and there are some in the works. Any other questions?
I think we have another.
Go ahead.
No, go ahead. I want to read out a question from online, so go ahead.
So there's another question in Whova specific to whether New York or New York's HIE has applied or is part of the process.
I can't
Or
really
is there-
verify.
Is there a link somewhere that you could post that lists who has applied and who has not, who those first QHINs are going to be?
Well, I would love to be able to share that. And I can tell you honestly that there was what I would call a big showcase done on February 14th, or actually 13th, the day before Valentine's Day, in Washington at the Department of Health and Human Services. And there were 6 candidate QHINs that actually showed who they were and all agreed that they were going to be implementing and live by the end of the year. Those 6 you can find, I can post. In fact, I'll put it on Whova since I do have the Whova app. I'll put a link to where that was posted so you can get those 6. The other one that has applied after that, we are not at liberty to share those, because what if they don't make it through the gauntlet of the onboarding and testing process? So we can't really release who has applied. And I can't really answer specifically whether New York has applied, but I will let you know that I do know every state is looking at this, and they're all working through what their connectivity will be, whether they'll be joining a QHIN or applying on their own. That is work going underway. Sorry, I am a little elusive there, but that's something with our cooperative grant with ONC we've agreed to kind of keep on the down low, so to speak, until they're fully designated. But I will on Whova app post the link to the recording of the candidate QHINs that had their applications approved to begin testing. So for full transparency, these are not QHINs that are designated yet. They all had their application, because there's a long application process. Lots of things they have to do, including being high trust certified and so forth, that they had to get through. So I'll push the link out there and you'll see who those 6 were, and hopefully that'll give you a little bit of a hint. Any other questions?
There aren't any questions in the room. So if you have any question later on, please put it in the Whova app. Thanks again for your presentation, and thanks everyone for joining.